Imagine there's a spot on your body that most men completely ignore, even though it might be the key to more energy, better circulation, and most importantly, getting your confidence back. I'm talking about a method that combines natural healing with modern medicine, and it has the potential to completely change the way you feel as a man. After more than 25 years as a physician, I've worked with countless older men, and what I'm going to show you today has helped so many of them reclaim their quality of life. Hey, everyone, my name is Dr. Chloe Bennett. I run my practice here in Boston, and I've been working with older men for well over 2 decades. What I'm sharing with you today is not some magic pill, and it's definitely not an expensive medication. I'm talking about something completely different, a simple 1-minute technique you can do in the privacy of your own home with nothing but your hand. No prescription needed, no copay, no awkward pharmacy conversation. But before I get into it, let me tell you about one of my patients. I'll call him Robert. He was 72, came into my office looking defeated. He told me he hadn't felt like himself in years. Low energy, poor sleep, and a sex life that had basically disappeared. His previous doctor just wanted to hand him a prescription and send him on his way. Robert wasn't having it. He wanted something real, something he could actually do himself. I showed him this technique. He was skeptical. Honestly, the look on his face said it all. But he tried it anyway. 4 weeks later, he walked back into my office looking like a completely different man. "Dr. Bennett," he said, "I honestly didn't think this was possible anymore." And that right there, that's exactly why I still love what I do after all these years. Now, before I show you how this works, we need to talk about a part of the body that most men never want to discuss. I get it, it's awkward, but stick with me here, because understanding this is going to make everything else click. I'm talking about the perineum, that small region between your scrotum and your anus. Most guys have never given it a second thought, but medically speaking, this little area is way more important than you'd ever guess. Here's what's going on anatomically. Right in that region, critical blood vessels run through that carry blood directly to the penis. The root of the penis is anchored right there, and just above it sits the prostate, an organ that plays a central role in both sexual function and urinary control. Now, if you're familiar at all with traditional Chinese medicine, this spot is known as the Huiyin point, the first point on the conception vessel, where several energy meridians intersect. I'm a Western-trained physician, so I'm going to give you the science-based explanation, but I think it's worth noting that healers across different cultures have recognized the importance of this spot for centuries. Under the skin in that area, you've got arteries and veins responsible for erection. You've got nerve bundles that carry sensation and signals up to the brain. And you've got pelvic floor muscles that control strength and function. When everything's working the way it should, this region is like a well-oiled machine. The problem is, as we age, things start to break down, and most men have no idea it's happening. Here's what aging does to this area specifically. Blood flow slows down. You might already notice that in other parts of your body, cold feet in the winter, tingling in your hands. Well, the same thing happens in the perineal region, except the consequences there are a lot more significant. Less oxygen and fewer nutrients reach the tissue. The nerves lose sensitivity, kind of like when your fingers don't quite work right typing on a cold phone screen. And the muscles tighten up or go slack because we never consciously train them. Nobody tells us to. Nobody talks about it. So it just happens quietly year after year. That's exactly where this massage comes in. By applying gentle, consistent pressure to this specific point, you can directly influence all 3 of these systems at the same time. You stimulate blood flow, you reactivate the nerves, and you release tension in the muscle. And the best part? You need nothing but your own hand and 60 seconds. Now let me walk you through exactly how to find this spot. Sit down comfortably. A chair works great, or the edge of your bed. Place one hand so that 2 or 3 fingers can reach the area between your scrotum and your anus. Move about 1 inch to 1.5 inches forward from the anus, and you'll feel a slight indentation. That's it. Some of my patients describe it as a soft spot between 2 firmer areas. That's the perineum. I know a lot of you are probably wondering if you've found the right place. Here's a quick test. When you apply light pressure, you should feel a sense of warmth or a mild tingling sensation. Some people feel a gentle pressure radiating toward the penis or bladder. That's completely normal, and it means you're in the right spot. If you feel that, you're good to go. Now for the massage itself. You've got 2 options. The first is simple sustained pressure. Use 2 fingers, press gently on the spot, and hold for about 60 seconds. The pressure should feel comfortable, not painful. Think of it like pressing on a ripe tomato. Firm enough to feel it, but not so hard that you're crushing it. That's your target pressure. The second option is circular movement. Press your fingers onto the point and make small circles. About 10 rotations in one direction, then 10 in the other. That also takes roughly a minute. A lot of my patients actually prefer the sustained pressure in the morning when they're still lying in bed, and the circular technique in the evening before sleep. Both work. It really comes down to personal preference. One of the most common questions I get is this: does position matter? Can you do this standing, sitting, or lying down? Honest answer: all 3 positions work. But I usually recommend starting on your back, lying down, knees slightly bent. In that position, your muscles are relaxed and the area is easiest to reach. Once you get comfortable and know exactly where you're going, you can do it sitting down. A lot of my patients have made it part of their morning bathroom routine. Some guys do it while watching TV at night. Whatever works for your schedule. How often should you do this? Once a day is plenty. The key is consistency. Do it at the same time every day so it becomes automatic. I recommend either right after waking up or right before bed. Some people do it twice a day, and that's fine too, but don't overdo it. More is not necessarily better here. Consistency beats intensity every single time. Now let's talk about what you can actually expect, because I want to be real with you. In the first few days, you might not notice much. Your body needs time to respond. That's normal. Don't give up. After about a week, most of my patients report a new warmth and awareness in the region, more sensation, better circulation. After 2 to 3 weeks, many notice a real improvement in morning erections. And after 4 to 6 weeks, a lot of men report a noticeable increase in overall vitality and sexual function. I also want to be upfront with you about something. This is not a miracle cure. I want you to have realistic expectations, because that's the only way this is actually going to help you. If you have serious underlying health issues, severe circulatory problems, diabetes with nerve damage, or if you've had prostate surgery, please talk to your doctor before starting this. This massage can be a great supportive tool, but it's not a replacement for medical treatment. For those of you with diabetes, here's some specific advice. The technique can absolutely help, but you need to be careful. If you already have nerve damage, you may not accurately feel the pressure you're applying. Start very gently and increase gradually over time. I've worked with several diabetic patients who've benefited from this method, but they had to start slow and pay close attention to feedback from their bodies. If you've had prostate surgery, the situation is a bit more individual. Depending on the type of surgery, nerves and blood vessels in the area may have been affected. In that case, I strongly recommend checking with your urologist first. In many cases, this massage is still helpful, particularly during the rehabilitation phase, but you want to make sure you're cleared for it. Now, here's something a lot of people don't expect me to bring up. Can your partner help? Absolutely yes. In fact, some of my patients tell me it actually works better when their partner performs the massage. It can become a genuinely intimate experience for both of you. The key is that you're both comfortable, the pressure is right, and you communicate openly. And if you've been feeling disconnected from your partner because of these issues, this might actually be a really meaningful way to reconnect. Communication is everything here. Let me also quickly touch on oils and creams. You don't need them. This massage works perfectly fine without anything extra. But if you want to enhance the experience, certain oils can boost the effect. In naturopathic medicine, essential oils like rosemary oil or ginger oil are often recommended because they promote circulation. Just be careful. Those essential oils need to be diluted before applying to skin, otherwise they can cause irritation. A few drops in a carrier oil like almond oil or jojoba oil does the trick. Some of my patients just use plain olive oil from their kitchen. Works just as well, and it's always on hand. The practical benefit of any oil is that your fingers glide more easily and the whole experience is more comfortable. But again, totally optional. One quick hygiene note: wash your hands before and after. I know that goes without saying, but I'm saying it anyway. And if you're using oil, throw a towel down first. Easy. Now let me go a little deeper on the science, because I think understanding why this works makes you way more likely to actually stick with it. When you apply pressure to the perineum, you're mechanically activating the blood vessels in that area. Think about pressing down on a garden hose and then releasing. The water rushes out with more force. That's essentially what's happening with your circulation. The gentle pressure encourages the arteries to dilate, and more blood flows into the region. At the same time, you're stimulating the nerve endings. Those nerves send signals up to the brain and spinal cord, and your nervous system responds by releasing nitric oxide, a molecule that is absolutely essential for erection. Without sufficient nitric oxide, the blood vessels in the penis can't dilate enough to allow an erection to happen. You know those ED medications you see advertised constantly during football games? They work by targeting exactly the same mechanism. This massage stimulates that same pathway, naturally, without side effects and for free. And on top of all that, you're activating the pelvic floor muscles. Think of these muscles like a trampoline that supports all the organs in your pelvis. In a lot of older men, that trampoline has gone slack, not because of any disease, but simply because nobody ever told them to train it. The massage activates these muscles reflexively, like gently waking them up and reminding them they still have a job to do. Now let me be honest with you about something else, because I think this part matters just as much as the physical stuff. A lot of older men I see in my practice are dealing with something that nobody talks about enough, the psychological side of all this. There's this quiet grief that happens when your body starts to change in ways you didn't choose. The energy fades, the strength fades, and for a lot of guys, when sexual function starts to decline, it feels like a piece of their identity goes with it. That feeling of helplessness is real, and it's hard. Here's what I want you to hear. This massage gives you something back that a lot of my patients have forgotten they could have, a sense of agency. You are actively doing something for yourself. You're not just waiting for things to get worse. You're not depending on a prescription. You're taking 1 minute out of your day to invest in your own body. And that shift in mindset, that sense of, I can actually do something about this, is genuinely healing, completely separate from whatever physical benefits you experience. I've had patients tell me they haven't felt this alive in years, not just physically, but mentally. Their confidence came back. Their relationship with their partner improved. They started enjoying life more again. And a lot of them tell me the change started with something as simple as this one daily practice. Here's another benefit that surprises most people: better sleep. I know that sounds like a stretch, but hear me out. The massage relaxes the pelvic floor muscles, reduces tension in the whole region, and promotes general relaxation throughout your body. A lot of my patients do it in the evening, and they consistently report falling asleep faster and sleeping more deeply. If you're someone who wakes up at 3 a.m. with a lot on your mind, give the evening version of this a shot for a few weeks and see what happens. Now let me give you 4 practical tips to actually make this stick, because knowing something and doing it are 2 very different things. First, lock in a specific time: morning right after you wake up, or evening right before bed. Set a phone reminder if you need to. After about 3 weeks of doing it at the same time every day, it'll become automatic. You won't even have to think about it. It'll be as natural as brushing your teeth. Second, keep a simple log. It doesn't have to be elaborate, even just a note in your phone. Did you do it today? How did you feel? After a few weeks, you'll be able to look back and actually see the changes. That kind of concrete evidence is incredibly motivating, especially on days when you feel like nothing's happening. Third, be patient. I know we live in a world of instant results and 2-day shipping, but your body doesn't work on Amazon Prime timing. Give yourself at least 4 weeks before you make any judgment about whether this is working. 4 weeks, that's it. I promise that's not too much to ask for the potential upside. And fourth, and I say this gently because I know it's not easy, talk to your partner about it. So many men carry these struggles completely alone and silently, and that isolation makes everything worse. Your partner is almost certainly aware that something has changed. Bringing them into this process, even just saying, "Hey, I'm trying something new and I'd love your support," can make a huge difference. Not just for the technique, but for your relationship overall. Let me close with this. In 25 plus years of medicine, the one thing I keep coming back to is how incredibly adaptable the human body is. Even in your 70s, even in your 80s, change is possible. I've seen it too many times to doubt it. One of my patients, I'll call him James, was 78 when he first came to see me. tired, frustrated, pretty much convinced that the best years of his life were behind him. He's 81 now. He still does this massage every morning. He told me last year that his wife said he seems like a completely different person, happier, more present, more like the man she married. That's not nothing. That's everything. You have more capacity than you think you do, and all of it starts with 1 minute a day. This isn't about chasing your 30-year-old self. It's about feeling fully alive in the body you have right now, and you deserve that at every age. Combine this with the other habits that support your health. Get some movement in your day, even if it's just a walk around the block. Eat well. Prioritize sleep. Stay connected to the people you love. No single thing does it all, but everything adds up. And this 1 minute is a powerful place to start. Give it a real shot. Be consistent. Be patient with yourself. Your body has carried you through decades of life. It deserves your care and attention. I believe in your ability to feel better than you do right now, and so should you. Take care of yourselves, everyone. Stay healthy, stay active, and remember, age is just a number.